Hi everyone, it's Linda Esposito from Be Clear with Bronchiectasis. I'm hearing that shorter videos are more popular, so I'm going to speak fast and try to make this short. But with that said, please subscribe to my channel, please like this video, and please comment. Please comment on any of my YouTube videos. There are, I think, almost 150 of them. I've been doing it for 2 years, and I always love seeing comments. So today I'd like to talk about showering, which is a hot button subject for many of us, because who wants to be told how to shower? Who wants to be told that you have to worry about bacteria in your pipes? Nobody. So the whole thing can cause a lot of anxiety. But you know what's so interesting? When people go to bronchiectasis centers, the doctors rarely talk about these types of precautions. Sometimes they do, but sometimes they don't, because there's not a lot of research. So at this point in time, without the research, we have different ways of going about it, and what your decision will be your decision. What works for you, what works for your lifestyle, what works for you at this point in time, because nothing says that you can't change over time. So I have other videos on this, so do look for them. But what I do at home is, I'm fortunate, I live in a 1-bedroom New York City apartment, but it's actually 2 studios put together, so we have 2 bathrooms. So I have my own bathroom. And I don't shower as much as I used to. I probably shower like 3 times a week, and then in between, I guess people call it a duck bath, do a sponge, what I call a sponge bath. But I do have both a wall mounted and a handheld. And I don't really use the wall mounted, I use the handheld. I like this particular one. It's called Aqua Dance. It's on Amazon, and I guess it's become the most popular one. It wasn't initially when I bought it 5 years ago for, I don't know, like $15, and now it's in the 20s, and they say best product or whatever, Amazon's choice. But I like it because it has those big dark holes. See those? And that's a fat stream of water, and that is what we're looking for. Dr. Falkenham likes a fat stream of water. So sometimes people just take the shower head off altogether, and they just have it coming out of the pipe, because that's one big fat stream of water. But if you do want a more traditional approach to showering, I like this, and I hold it close to my body when showering. I actually did a video in the shower. You can search for it, just to show you that I could do a 1-minute shower very easily. But I like to use this because I hold it close to my body, and it creates very little vapor that way. So this is my favorite go-to. Every so often I swap it out. It comes with a new hose. There is still bacteria in the pipes. You can't get away from that. But I like knowing the hose is new and that the head is new. I use it just for a very short time. No one else is using this bathroom. So this system works for me. Some people prefer to take baths. I'm not going to take a lukewarm bath. Nope, no can do. But this system works for me. Now, while traveling, and I do travel, I love traveling, we've worked on a few other solutions. So some people are handy enough where they take the shower head off at the hotel or their Airbnb, and they feel confident that they're going to be able to get it back on. I'm not so confident. And so what I do instead, Bronchi Sister Melody came up with this approach using a mesh bag. And she, I think, just tied it at the bottom, and because of the mesh, it gathered up the water. So you tie it around the shower head that's attached to the wall, and then it gathers up the water, and it just kind of comes out in a fat stream at the bottom. So she sent me one, which was so sweet. Of course, I had a mess with it, and I cut it. Now we look like we have fancy underpants, but they're not. But in a pinch. Anyhow, so I just hand sewed it so that you could see that, and because I was too lazy to take out my sewing machine. So it all comes down to this one opening, and I used a tie from a pair of pajamas, and I just tied around the shower head, and it all comes out. What I found was sometimes it comes out through the stitching or the fabric as well. So it's a good approach. But what I still like best, I have a problem with hoarseness for 30 years, so nothing new. What I do like best is using a plastic bag. And you can reuse it, so if people say, oh, plastic not good, get it, I understand, but you can keep on reusing it. This particular plastic bag that we bought has this gusset, I don't know how else to describe it, on the bottom. That's not helpful. It would be good if it were just the old-fashioned straight across. Then you cut the corner, and then you use some ties or something, twisty ties, to get it up there around the shower head. So this is another option for showering when we are traveling. Okay, hope this is helpful. Always discuss all of this with your medical team before making any changes. I'm an educator, not a clinician, but I'm here to share with you what I do and what I know. Okay, everyone, take care. Bye-bye.